Good afternoon. Good afternoon. Welcome, family. Welcome to our 2025 Open Enrollment Virtual Town Hall. I am Ryan the Lion, and I'm your host this evening. Make sure you hang out with me weekdays, Monday through Friday, 10 a.m. to 3 p.m. inside the Lion's Den. And today I have the pleasure of hosting our Maryland Exchange Virtual Town Hall, all about the open enrollment season, man. We're trying to help folks get together and get their insurance coverages right and to kind of help us navigate all this craziness, all this information. I have the one and only Clarence Beckett. He's an enrollment outreach worker, represent the state's health insurance marketplace from Maryland Health Connection. Clarence, welcome, welcome, welcome. Thank you for joining us this evening.
All right.
How
Thank you,
you
Ryan.
doing?
Appreciate you having me.
No, not a problem. Not a problem, man. It's that time of year, man. Open enrollment is here. Folks got a lot of stuff to think about, and there's a lot of information out there that they need to cipher through to make sure that they can make the best decision for themselves and their family. So let's start off first by just getting into Maryland Health Connection. What is it? How does it work?
Okay, sure. Maryland Health Connection is the state's official health insurance marketplace. It's a one-stop shop where folks can browse, they can compare health plans, they can find savings, they can get covered. With upcoming federal changes, reviewing your options is especially important this year to ensure that you get the best coverage and savings.
Yeah, so again, like I said, a lot of information out there when it comes to these insurance coverage plans. So we talk about open enrollment. It only happens for a specific time. When can people enroll?
Well, actually, open enrollment is going on right now, Ryan, and it's going to end on January 15th through of 2026. If you're just curious, you can compare health plans using the Get an Estimated tool on our website, marylandhealthconnection.gov. And you can browse those plans. You can see how much you can save, or you can just go ahead and apply. If you want to be covered in the new year, make sure you enroll by December 31st. This is very important if you want your coverage to start January 1st. If not, if you enroll in January, your coverage won't start till February 1st of 2026.
See, now that's very important because I know one year for me personally, I was like, I got time. I got it. It's going to come. I got it. Don't worry. And next thing you know, I missed it and then had a life event and I didn't have coverage. It was, something that I was like, man, I let the ball drop on that one. So very, very important. Those dates are absolutely very, very important. So again, make sure you are enrolled by December 31st. If you want your coverage to start, what was that?
January 1st, 2026. Make sure you're enrolled by December 31st if you want your coverage to start January 1st. Even though open enrollment doesn't officially end until January 15th, but if you enroll anytime in January, your coverage is not going to start till February 1st.
Yeah, very, very important. So make sure we are paying attention to those dates, family. Now, when it comes to coverage, what is covered?
Okay. So all plans, Ryan, through Maryland Health Connection cover important health benefits, including doctor visits, prescriptions, mental health services, and more. There's also plans that cover dental and vision as well. Maryland Health Connection offers health plans from insurance companies like Care First, Kaiser Permanente, WellPoint Maryland, and United Healthcare. No matter where you live in Maryland, you will have a choice of plans from multiple insurance companies.
Okay, so this is not based on what county you live in. This is not based on what city you live in. If you're a Maryland resident, this applies to you.
That's correct. Regardless of where you live in Maryland, depending on what now, there are certain coverage areas, certain carriers that may not cover in certain coverage areas, but the website will tell you that, right? But if you live in the state of Maryland, you can go through your marketplace and enroll in coverage in one of those plans if you so desire.
All right. Now, we mentioned it a little bit earlier because, again, a lot of information when it comes to these insurance coverages. If you ever trying to read up on it, you see it, man, it's a lot. It's a lot. It can get very, time consuming. People be like, I don't want to go through all of that, but it's very important to make sure that you understand what you're getting and what you're signing up for. And especially now with all these different changes, federal laws, things are changing. What can you tell us about these federal changes that are affecting health coverage starting this year, I guess?
Yeah, so Ryan, there's been a plethora of health changes that are going to affect 26, 27, and 28, but the recent changes, recent federal actions are going to impact how Maryland's apply or renew their coverage and how much it costs. Premiums may increase for next year for 2026, and some people maybe lose their eligibility for savings. So in that case, Marylanders may see the cost of their 2026 health plans go up. The federal government will no longer provide the extra savings that many Marylanders were used to help pay for the part of their premiums. Although other savings will still be available, the change will increase cost effect overall. So Marylanders, they can visit marylandhealthconnection.gov. They can see where they can get an estimate for 2026 health plans by using the estimate tool that I talked about earlier to help keep your family covered. We're to help you, and we're also here to help you find a plan and help one to pick one that's right for you. So starting in 2026, Marylanders who are not eligible for Medicaid due to immigration status and earn an income below 100% of the federal poverty level, typically that's about $15,650 a month for an individual, right, will no longer qualify for tax credits for private plans through Maryland Health Connection. So in other words, you won't get the subsidy any longer that they get in the past based on the new rules that came for the current administration changes.
Now, it's also, I'm sitting here thinking open enrollment, people are like, okay, I'll just go with what I had last year. There may be some changes to what you had last year. So you need to really make sure you're up to date on everything and, making sure you're hitting the website, marylandhealthconnection.gov, and getting the necessary information. Don't think it's just going to be that easy where, oh, yeah, we'll just sign back up for everything we had last year.
Right. And so it's important that a lot of folks understand that the current coverage that they have right now is going to stay to December 31st. Mm-hmm. But the change is going to go into effect, obviously, for 1 January 2026. So we encourage you to take a look at those coverages that you currently have, compare them to the plans, use that estimator tool I talked about earlier, compare them to the plans that's out there for 2026. So don't put off getting your checkups. And one thing I suggest to folks is if you know your 2025 plan hasn't changed, don't put off, though you still got time. It's only the 10th of December, make those doctor's visits, get those things that your plan's going to cover right now. That's going to help with you. It's going to be there till the 31st of December. So don't put off getting those checkups and any other care that you may need. You can explore the plans and prices. This year, especially important to review your options. Starting October 2025, we already uploaded the plans for 2026 and prices that you can see on the marylandhealthconnection.gov website. There may be better options for your needs and budget. So take the time to compare the plans and fit the coverage and find the coverage that fits for you. Check Maryland Health Connection account for updates. Submit any requested documents you want. You can avoid losing coverage as well, too. So you can avoid losing that coverage.
Yeah, we don't want you to lose coverage, especially these days. We can't afford that kind of stuff nowadays. Right. Now, for folks with immigration, I know that's also a big thing. This year, especially with this new administration, a lot of immigration things are on the table. That's affected a lot of folks. When it comes to this getting Medicaid or something like that, what's going on with the immigration status and, people, I guess, not making that much money?
Well, so again, as I was speaking before about the 100% FPL federal poverty level, the federal government comes out every year to establish what the federal poverty level is going to be for the next upcoming year. So those folks that are at 100% federal poverty level and don't have an immigration status that will give them the tax credit as they did before, they may wind up saying that their costs are going to increase because they have no longer access to those subsidies that were available before. So again, the biggest thing, Ryan, I can encourage folks, I can't stress enough to make sure you're logging into your account or you're calling the call center if you need to, checking online at marylandhealthconnection.gov and see how those plans are going to affect you for 2026.
So let me ask you, because if you right now say someone is thinking about, just kind of getting an idea of like, all right, let me see what's out there. You can go on the website and you don't actually have to complete anything when you're there. You can kind of get the information and, go through it and see what's best for you.
So absolutely. So on the marylandhealthconnection.gov website, you don't have to have an account. You don't have to sign in. You don't have to do anything. You can actually go to the landing page of the marylandhealthconnection.gov website. You go to that landing page, and I think it's some type of mauve or purple color. Don't quote me on the color, but you can look, get an estimate. You click on get an, we call that the estimator tool. You click on get an estimate, and when you get an estimate, it's going to ask you for your zip code. It's going to actually provide the county of that zip code. It's going to ask you what type of coverage you're looking for. You're looking for health. You're looking for health and dental. You select that, and then it's going to have drop downs. It's going to put your age, what type of coverage you're looking for, is whether you have a spouse, whether you have dependent children, and then the very last block, it asks you, what is your total gross annual income? You put that figure in. You put that figure in, and then you click on next, and it'll automatically calculate and tell you what you're looking for, or what you may have been looking for. But I do want to stress, Ryan, however, though, that's just an estimate. There are other factors that may apply in there. For example, immigration status, those type of things may apply. But for the most part, it just give you an estimate. It'll kind of get you in the ballpark of where you need to be, where you might want to be.
That's right. If you're just joining us, it's the 2025 Open Enrollment Virtual Town Hall, all brought to you by Maryland Health Connection. My guest today is Clarence Beckett from Maryland Health Connection, and we're talking about getting folks coverage for the new year. 2026 is going to be here before you know it, and if it comes to getting you and your family covered, well, this is where you need to be. This is where you need to go to get the information so that you are covered, and that you and your family can move forward freely. Because I mean, not having no insurance, you're gonna have to walk on like you can't do nothing. You can't get sick. You can't do nothing, man. So make sure you and your family are covered, no matter what the situation. Again, MarylandHealthConnection.gov. Now, we talked about people getting covered. We talked about some of the laws. Now, how should people stay covered, man? Like, what should they do to make sure that 2025, whatever their plan has, moving into this next year, that they're going through the estimator, they're getting all of this stuff. What can they make sure they do so that 2026 they are absolutely covered and set for the new year?
So that's a great question, Ryan. So we encourage folks to make sure one of the first things I want to say is to you that your 2025 plan hasn't changed. I mean, it's 21 days before it ends, but it hasn't changed. So that's the good thing, right? So don't put off getting checkups and care that you need, as I said before. Explore plans and prices. And another way that you can do that, again, is use that estimated tool that we talked about this year. It's especially important to review your options. Right, you can compare 2026 plans and prices. Again, at MarylandHealthConnection.gov, there may be better option for your needs and budget. So take the time to compare the plans and find coverage that fits. Again, I encourage you, take the time to find the plan and coverage that fits for your needs. Right, check your Maryland Health Connection account again for updates. And again, another important thing is make sure you submit any requested documents to avoid losing your coverage. Right, so that's important, again, for you to stay covered and also to look to see what's available for 2026 as well.
And I'm sitting here thinking too about a lot of folks have pre-existing conditions, right? They have stuff going on. And if you are dealing with something, you want to make sure that you pick a coverage that can help, you get the medical attention you need moving forward. I mean, so you're going to have to really maybe sit down, take some time and do a little bit of homework.
And you're right, Ryan. And the good thing about that is the Affordable Care Act states that it doesn't penalize folks for having pre-existing conditions. So those folks that may have diabetes or those folks that may have some type of pre-existing condition, you can still sign up, and it doesn't you don't lose coverage or will be denied coverage based on that pre-existing condition, which is extremely important. So again, I always say to folks that insurance is the only thing we purchase hopefully we never have to use. But it's a good idea. And personally, I can have personal stories I could probably tell you, but we don't have that much time. But I will tell you that I got sick some years ago. If it wasn't for the personal insurance, I don't know how my private insurance, I don't know how I would have been able to afford the hospital stay. So it's important.
Yeah. It's absolutely important. I know for me personally, the beginning of this year, long story short, kids versus coaches basketball game, and I took a jump shot, Clarence, and my Achilles was not prepared for the jump shot. It was still on the sideline, and I ruptured my Achilles, man, and I had to get surgery. And I don't think I would have been able to pay that bill normally without insurance, man. Some of these medical expenses are absolutely astronomical. So please make sure you are covered. Get your family covered, and be careful if you're playing coach's kids basketball game. Make sure you stretch extra good. Don't be like me.
So Ron, the old expression is for those of us that used to don't anymore. We just watch. So
Yes, yes. I wish you would have given me that advice beforehand. Man, I'm still feeling it. I'm still going through rehab and stuff. So that's just shows you the importance of coverage and the difference it can mean for you getting better or and coming through this with not as much money out of your own pocket. So we want to make sure we look out for the community. We want to make sure we're looking out for families right here in Maryland. Very, very important. No matter what your situation or your status, please make sure you go get covered. And I'm thinking about all these people out here that are like, I don't need insurance. I don't ever get sick. I don't go to the doctor. Man, does that change the older you get? Man.
absolutely, absolutely. So I'll just tell you as a personal story, if I may,
Mhm.
Ryan. In a week's time, I developed Bell's palsy,
Mm.
and I had pulmonary embolisms on my lung, all at the same time within
Wow.
with a week each other. That was November 2015, so almost 10 years ago. But it all happened, and up to then, I had never been sick, never had to the doctor's. I mean, besides regular routine doctor visits,
Right, right.
nothing happened. Everything happened to me. My stay in the hospital for a week was almost $7,000 just for the stay. So I'm telling you guys, and I can't, say out to the public enough out there how important insurance is. Again, it's the only thing we purchase. We hopefully never have to use. But again, Maryland Health Connection is going to be that resource for you guys. State Marketplace will be that resource for you guys to take a look and see if what type of plans that you can purchase for yourself and your
Yeah.
family.
Right, right, absolutely. Now, we talked about enrollment and the dates. What kind of help does come with the enrollment? What kind of people, what kind of help can people, kind of say, hey, when I'm enrolling, what are they helping me out with here?
Sure. So Maryland Health Connection call center. There's a call center, and I will give you that number. It offers over the phone assistance, and it also has over 200 language lines that they can help you with for interpreter assistance in case you need some type of interpreter assistance. You can reach them at 1-855-642-8572. Again, that's 1-855-642-8572. And if you need help doing open enrollment, we're here to guide you through those federal changes and help you stay covered, help you pick the right plan if that meets your needs. And here's a good thing: the help is free. You just go to marylandhealthconnection.gov/find help, or call that 1-855 number I've just given you, and it's absolutely free for you to actually get enrolled if you like, or get the help and assistance that you need. The assistance is free. You can visit marylandhealthconnection.gov again, find help to explore virtual and in-person visits. Join us online or in person, whatever works best for you. We're here to help.
Yeah, I'm glad too. I'm glad that they offer that because I know a lot of folks, probably a lot of older folks are like, I'm not going to go through all that. I need to talk to somebody. I need somebody on the phone. I got questions, you know.
Right.
So it's great that they get all that kind of help. We definitely appreciate that. I know our older folks are definitely appreciating that. Um, Now, Maryland Health Connection, again, we are here for our 2025 Open Enrollment Virtual Town Hall. If you have questions, please hop on the chat, ask us. We're trying to help people out. Get ready for 2026, get covered, you and your family. A lot of changes are going on, especially with federal laws. A lot of things are different. A lot of things are being adapted. So make sure you're in the know. Make sure you know what's going on. You got to make the best choices for you and your family. And again, we said it earlier, but it's going to take a little bit of homework. It's going to take a little bit of research. It's going to take a little bit of reading. It's going to take a little bit of time. But all of that is for the betterment of you and your family. So when people are thinking about Maryland Health Connection and thinking about getting coverage and thinking about, my family needs this, my family needs that. You said there were also in-person events happening, right? Uh,
Sure. Yeah. So
uh,
there are some in-person events that's happening. You can go to the marylandhealthconnection.gov website and find those person events. Um, there are a lot of connect entities throughout the state that are sponsoring in-person events, and you can go to marylandhealthconnection.gov website and look for those and find something that may be in your area that you might want to to do. I know that there, if I can kind of plug a local event that's going to happen here. I know December 13th at 8100 Wise Avenue, which is the Patapsco High School in Dundalk. There's from 10 to 2. There is an open enrollment event there. So if you need in-person assistance, you're more than welcome to come out, and we'll be there to help you, assist you if you need that assistance as well.
Yeah, I'm glad you mentioned that. I'll be out there, man. So I'll be out there again on December 13th. So that's going to be a fun time helping families out. Do me a favor, class, to give that information out again. So I want people to make sure that they can come out to that.
Okay, so it's at Patapsco High School, which is 8100 Wise Avenue in Dundalk, Maryland. It's going to be Saturday, December 13th, from 10 a.m. to 2 p.m. for the public. We'll be there a little early, and that obviously setting up those type of things, Ryan. But for the public, be there from 10 to 2. Okay.
Nah, it's a lot of information again, man.
I encourage
a lot
folks,
of information.
Yeah, we just had an event in Laurel, and we were overwhelmed, quite honestly. So I encourage you to get there earlier, so you can we're actually going to sit down in front of an enrollment outreach worker, and we'll be able to walk you through those plans if you need to, or even that we may even have some broker assistance. Brokers are licensed in the state of Maryland to actually sell insurance, so they can tell you what we do as a Maryland Health Connection outreach workshop. We can only recommend, not really recommend, brother. We can tell you about the different plans and show the comparisons. A broker can actually steer you and tell you what's the best plan for you. So they'll be on site as well to help you. Okay.
Now, Clarence, you are a wealth of knowledge here, buddy. You know a lot of stuff. Now I got to ask, how long have you been with the company, with Maryland Health Connection?
So I've been in some formal capacity or another. I've been dealing with the ACA with Maryland Health Connection since its inception, 2014.
Wow.
So
Wow.
I've been around a few years with it. So,
yeah. So we're talking to the right person here. Now, is there anything that people that we haven't mentioned that people need to know about getting covered for 2026? I know we've touched on a lot, but is there anything else you want to?
Yeah, I'm sorry, I didn't mean to cut you off. I apologize.
No, I was going to say, is there anything else you want to say about it? Yeah.
Yeah, I think we both kind of, we stress the importance, and I can't stress enough how important it is, guys, for you to look at your current plan, compare those plans, use that estimator tool that's available to you on the Maryland Health Connection website. Again, it's no obligation to use that tool. It doesn't change. Even if you're enrolled currently, using the estimator tool doesn't change your current plan or your plan that you may have been already renewed in for 2026, but it gives you and allows you to options. And then it also, on the Maryland Health Connection.gov website, on this platform, there's a tab that says Find Help. You can click on Find Help, and you can actually ask for a broker, or it'll tell you where you can find help again in person. We kind of plugged our event that we're having on Saturday, but it also shows that you can get help, and if you just want to have a broker assistance, those folks that are licensed in the state of Maryland to actually sell the insurance to you, and they'll help you. And typically, you get help. You get a response within 30 minutes or so. So you ask for that help. So typically,
sitting here you tell us about being able to compare plans. I think that is such a great help for folks, because you think about reading about your plan that you currently have and then trying to jump on what's the difference between some other upcoming plans you may be considering, to be able to compare them and do the homework and research that way. Man, that's a great asset and a great help. I know that's tremendously helping a lot of people when it comes to choosing.
Sure. So obviously people's health needs may change from year to year, depending on what type of health you need. You may have. All the plans comes with something called an SBC, stands for Summary of Benefits of Coverage. You're able to actually see that. It'll take you from the Maryland Health Connection website to an external website of that carrier that you're looking at. And then you can actually go down and tell you, okay, what if I have a hospital visit? How much does that cost? What does I have an urgent care visit? What is the copay for prescription drugs? I'm just giving some examples.
Right.
You can begin that access all through, again, the Maryland Health Connection.gov website.
Listen, give that website again, because somebody listening right now is like, what? I need to go do this right now.
Sure. So it's www.maryland, spelled out, healthconnection.gov. So Maryland, www.marylandhealthconnection.gov.
And I know we only have about 5 minutes left, but once again, this is our 2025 Open Enrollment Virtual Town Hall with Maryland Health Connection. We are all talking about getting people covered for 2026 and your options and all the things available for you. And Maryland Health Connection is trying to make this as easy as possible for you and your family. So many tools, so many resources. I'm so glad I met Clarence now. Listen, Clarence, you're about to be my my go-to. You know, you're like having a website itself, man.
Thank you. So, yeah. So, and the good thing about it again, Ryan, is that the enrollment outreach workers that you speak to, whether it's myself or another person that may be there, we're all experienced and all trained to help you and get you through that application process, to make that process. And I get it. It can be kind of overwhelming for those who might not know what is it? How much is my plan going to cost? What coverages is those type of things? We can show you all of those things ahead of time to allow you to make a well-informed decision based on the questions that you may ask us. So no matter who you sit in front of, if you come to one of our events or if you call our call center at 1-855-642-8572, we're more than trained to help you, give you the information that you need to know so you can be ready and prepared for your health needs in 2026.
And just so people understand how important this health coverage is, you see the government shut down earlier this year, and the cause was the difference in perspectives on healthcare, which is absolutely unbelievable. So it is an important thing for so many people, and we want to make sure our Maryland residents are on the better side of getting covered for their family. So please, family, make sure you are paying attention, make sure you are reading, make sure you are hitting the Maryland healthconnection.gov website, get all the information you need, do the research. Lucky for me, my wife is the research person when it comes to all these insurance coverages, and I get the kind of insurance for dummies coverage after she gets all the information. She kind of breaks it down for me, you know. So if you don't have a wife like mine, you're gonna have to do a lot more work. And and I'm grateful for her, but I'm grateful that Maryland Health Connection is actually thinking about the people and you know, trying to make this again as accessible and as easy as possible to get all this information, because it is a lot. It's a lot.
Absolutely.
So we have about 3 minutes left, Clarence, and I know if anybody is here to have a question, please type it in the chat. But I know that someone in the building was talking about, you know, getting coverage, and they're talking about their family. They have extended family, that, you know, blended family. They got all kind of stuff going on. Is there any difference when it comes to covering your family biologically, or, you know, when it comes to like a blended family, new marriage, newlyweds? Any of these things affect anything?
So that's a great question. There is a plethora of household composition rules, if you would say, for the lack of speaking. There's a plethora of household composition rules that may go along with that. And again, those enrollment outreach workers can tell you that. So it may be that you're just you're not married, but you could be the biological parent of a child. So together, that makes you part of the household. So that's just an example. There's a plethora of examples that go along. Again, I encourage you to use the MarylandHealthConnection.gov website /find help to get that, or even visit one of our outreach enrollment events. Or again, just go into MarylandHealthConnection.gov website, get an estimate tool, plug in your information, and the system will actually tell you, get you close to where you need to be. And then if you need to, you can actually call and enroll. If you don't have an account, they actually do an account right over the phone for you and then help you apply as well.
Yeah, absolutely. I love it, man. I love it. And again, if you're just tuning in, 2025 open enrollment. Open enrollment is happening right now. It is open. Folks, don't waste any time. Get involved and make this a priority for you and your family. Now, we got less than a minute here. Could you give out the information one more time? And I would love for you to give out the date for this weekend again, so people can come on out and hang out with us.
All right, so you can reach us at MarylandHealthConnection.gov. That's www.Maryland spelled out clarence-connection.gov. The phone number there is 1-855-642-8572. We also have a local event that's going to be held at the Patapsco High School, 8100 Wise Avenue in Dundalk, Maryland. That'll be on Saturday, December 13th from 10 to 2.
So come on out, family, get some information. I'll be out there. Clarence, will you be there?
I'll be there.
All right. We're going to be hanging out. So come on and hang out with us, get some information, and I'll get you and your family covered for 2026. Clarence, I can't thank you enough for this information. Thank you for taking the time to sit down and chop it up with us about this. And I can't going to help some more folks. I look forward to it.
My pleasure. Thank you for having me.
All right. And